In this video, I'd like to talk about why hyperemesis is such a complex and difficult condition to treat properly. Now, for first-time HG patients, they do see effective treatment when they come to Antai Hospital, especially those that come before pregnancy or the early days of pregnancy. And then once we administer our proprietary HCG desensitizer, which are just injections that we give them every week, and we monitor that their symptoms significantly subside, their health levels are restored, and then these patients have truly recovered, and then they are discharged from the hospital. Now, three distinct symptoms of hyperemesis, as always, firstly includes the excessive and violent vomiting or severe nausea that we see women have. Secondly is also the insomnia or the lack of ability to fall asleep. And lastly is the excessive salivation that we see. Of course, there are also other symptoms, but because hyperemesis is a very complex condition, now a lot of symptoms vary from patient, but in general we do see these three types. That is very common. So for certain group of patients where they have severe hyperemesis, they come during the midst of their pregnancy, these types of patients, we need to give them extra treatment. This is due to the presence of pre-existing conditions. Now, these pre-existing conditions may not even be visible to you. You may not even be aware before pregnancy. But the thing about hyperemesis is that it has an ability to aggravate, also trigger, and also intensify whatever pre-existing condition that you might have. Because we know that hyperemesis is a neurological condition that originates from the brainstem, which is a central sensitization, a hyperstimulation of all your nerves, the central nervous system. So of course it will aggravate whatever hidden condition that you might have underneath. So some examples include some psychological trauma, some mild or severe depression, some gestational diabetes, gestational heart disease, gestational hypothyroidism, and so on. There are so many conditions that might pop up alongside with hyperemesis, and this is what makes it extremely difficult and complex for us to effectively treat you. Not only do we need to treat you with our HCG desensitizer to stop the vomiting and the severe nausea, we also need to treat you of whatever pre-existing condition that you have. And this requires accurate diagnosis and also effective treatment. Now, depending on how many pre-existing conditions you have, how severe they are, or how complex they are, this really makes treatment difficult. Of course, if you are aware of your pre-existing condition, this will help us give more information. Also makes us have a better ease in treating your condition. So I hope this video has given you certain awareness that hyperemesis, although we can treat your condition, it has an ability to aggravate and trigger whatever underlying condition that you might have, whether it's neurological or psychological or physiological. Hyperemesis will trigger it and also intensify it. So we do advise you, if you want your hyperemesis to be treated effectively, come before pregnancy or the early days of pregnancy. If you do come during the midst of pregnancy, well, we need to treat your pre-existing conditions to ensure you have a smooth and successful pregnancy.